Good morning. Thanks to all of you for joining today's call. I'm Sarah Lovenheim, Assistant Secretary for Public Affairs at HHS. We know we're starting a few minutes into when we had hoped to, so we thank you all for your patience. The purpose of today's press call is to discuss the state of our response to monkeypox. Today on the line, you will hear from Secretary Xavier Becerra, who will deliver brief remarks, followed by Captain Jennifer McQuiston. She is the Deputy Director for our Division of High Consequence Pathogens and Pathology at CDC. And then you will hear from Don O'Connell, who is now our Administrator for Strategic Preparedness and Response at HHS. And then we will turn to Q&A, where we will open up the call and you can hit *1 if you have a question. And we will keep the focus of the call to the topic at hand, just given timing. And we also want to let you all know that we've got Dr. Peter Marks, who is the Center for Biologics Evaluation and Research from FDA on the line, to join us as well for the Q&A portion. With that, I will turn to Secretary Xavier Becerra to give opening remarks. Thank you.
Good morning, and thanks everyone for joining. Forgive my voice. I want to thank everyone from our team at HHS for being on this call, but I principally want to thank everyone at HHS for all the work that we've been doing to tackle monkeypox. If I could, before I begin on monkeypox, just simply reiterate what I believe Sarah Lovenheim just mentioned, and that is that we have our administrator for Strategic Preparedness and Response for ASPR, for the Administration for Strategic Preparedness and Response, what everyone knows as ASPR, who is with us. And the reason I mention that is that Administrator O'Connell, up until recently, was known as Assistant Secretary O'Connell. But because we have transformed our Office of Preparedness, for the Assistant Secretary for Preparedness and Response, to a full-fledged operating division within HHS, we now have our Administrator, Don O'Connell, for the Administration for Strategic Preparedness and Response. That we did because, as you can see from COVID, and now, of course, even now with monkeypox, the role of our ASPR has increased dramatically, and therefore we want to recognize that by making sure that we provide it with the tools it needs to be as quick and nimble in its response as possible. So, again, my congratulations to Administrator O'Connell, who is joining us on this call. Okay, monkeypox. Let me begin by first saying every American should pay attention on monkeypox. Monkeypox is not COVID, but it is contagious, it is painful, and it can be dangerous. At the Department of Health and Human Services, our goal is pretty straightforward. Stay ahead of the virus and end this outbreak. And at HHS, we're doing everything we can in that regard. On vaccines, we have so far less than 5,000 cases that have been reported, but we have already in hand secured more than 1.1 million doses of the Jynneos vaccine. On testing, we know that we started when the first case in mid-May was reported of monkeypox here in the U.S. We had about the capacity for about 6,000 tests to be performed on a weekly basis. Today, the capacity in this country, thanks to the great work of our teams at HHS, are now between 60 to 80,000 test capacity per week. On treatment, because there is a treatment, TPOXX, people have heard of TPOXX as therapeutic treatment that is available. So far, we have seen that treatment administered and provided to a little less than 10,000 Americans to date. We have in our strategic national stockpile 1.7 million treatments available for Americans. On education and outreach, which is critical in these early stages of any outbreak. Well, let me give you a quick example. Just a couple of days ago, CDC held a call with some 10,000 clinicians to, again, give them whatever information they needed, answer any questions they had with regard to monkeypox, so that it is clear people have the correct information on monkeypox and what they can do and what we are doing to help. Every week, CDC holds a call with the relevant jurisdictions, healthcare officials in the state and local governments to make sure they get it. And on a daily basis, CDC is in touch with clinicians, officials, and community members. Quite a bit of outreach has been done with communities that might be impacted as well. And we have Captain McClintock who can give us Captain McQuiston, who can give us more details on that. Everyone, and I want to repeat that, we need everyone, whether it's state and local health officials who oversee healthcare and are responsible in their jurisdictions for healthcare. We need people who are at risk, and we need all Americans to do their part and take responsibility to help us tackle monkeypox. And so today, we are announcing that we have secured at HHS and the Biden administration an additional 786,000 Jynneos vaccines on top of the more than 338,000 vaccines already in hand that have been delivered to our state and local partners, to give us more than 1.1 million vaccines that we can say with confidence will be in the hands of people who need them over the course of these next several weeks. And so what we want to do is make sure that we give people the correct information so they can make the right decisions. And moving forward, we can work in partnership to, as I said, make sure that we not only stay ahead of this virus, but that we end this outbreak. With that, let me turn it over now to Sarah Lovenheim, who I think will now move us to Captain McQuiston.
Thank you. Captain McQuiston, over to you.
Good morning. I want to start with an update on the ongoing monkeypox outbreak and CDC's continued response. As of July 27th, over 20,000 cases have been detected globally in 77 countries. And here in the United States, there have been over 4,600 cases of monkeypox identified across 48 jurisdictions, including states, Washington, D.C., and Puerto Rico. This includes an increase in cases recorded over the last 2 days that reflects historic cases that are now being reported to CDC through electronic data streams. Yesterday, CDC released an epidemic curve for monkeypox that provides a picture of case trends in this country over time. That's now available on the web, and we're going to update this data on a weekly basis as we go forward. CDC is also releasing a technical report very soon that summarizes early results from CDC's response to the current monkeypox outbreak and provides data that people can use for research. We also have additional data on demographics and clinical presentations of reported cases in the U.S. as of yesterday. For those who have available age data that are reported, the median age is 35 years old with a minimum of 17 and a maximum of 76. I'd like to note that this does not yet include the 2 cases in children that we reported last week. For those with information available about sex assigned at birth, 99% were assigned male sex at birth, and the vast majority reported male-to-male sexual contact. And overall, among those with race and ethnicity data reported, 37% of cases have been among non-Hispanic white people, 31% among Hispanic or Latino people, 27% among non-Hispanic Black or African American people, and 4% among Asian people. The 4 most common symptoms reported in case report forms include rash, which was reported in 99%, followed by malaise or feeling tired, fever, and swollen lymph nodes. Other symptoms reported included chills, headache, and muscle pain. As we continue to work closely with jurisdictions to improve data reporting and with healthcare providers to better understand how patients are being tested and make sure they know how to test them, we expect the number of reported cases are going to go up over the next several days and weeks. We continue to share new information with healthcare providers through web postings and our calls with clinicians and also health alerts that we send out. As Secretary Becerra mentioned, just this week we had a call for over 10,000 clinicians where we talked to them about testing, how to access treatments, and really emphasizing the new streamlined process for obtaining and using TPOXX. CDC strongly encourages all healthcare providers to be on high alert for patients presenting with monkeypox symptoms and to test any patient for whom monkeypox is suspected. We're also working closely with HHS and ASPR on the federal vaccine allocation strategy. And as more vaccines become available and we learn more about this outbreak, we continue to update that vaccination strategy. With the additional doses being announced today, we have again updated the plan for allocating doses to take into account two key factors: the total population of people at risk in a jurisdiction and the number of new cases in each jurisdiction since the last allocation. This update gives greater weight to prioritizing vaccine to areas with the greatest number of people at risk, which includes men who have sex with men who have HIV or who are eligible for HIV PrEP, while still considering where we are seeing cases increase. This strategy also makes sure that jurisdictions have the doses they need to complete the second dose of this two-dose vaccine regimen for those who've already been vaccinated over the last month. Our U.S. vaccine strategy continues to be responsive to where we're seeing cases now and helps us stay ahead of where this outbreak may lead in the future. And as we have said since the beginning, we're going to continue to update and adjust the allocation of vaccines and our strategy as supplies increase to ensure vaccine doses are available for those who are most in need. And with that, I'm going to turn it over to Administrator Dawn O'Connell.
Thanks so much, Jenny. And I am Dawn O'Connell, the Administrator for Strategic Preparedness and Response. And I want to underscore that responding to this outbreak has been and continues to be a critical priority, both for ASPR and for all of us at HHS. As the Secretary said, our actions began as soon as the first case was detected in the U.S. HHS launched a rapid response by distributing vaccines, significantly increasing vaccine supply, expanding access to tests, and making treatments available for free. Within days of the first case, the Strategic National Stockpile began shipping out vaccines and treatments to jurisdictions in need. And we directed Bavarian Nordic, the manufacturer of Jynneos, to bring vaccines that we had purchased and stored at their facilities in Denmark to the United States. As of July 27th, HHS has distributed more than 338,000 doses of the Jynneos monkeypox vaccine to states and jurisdictions. And we're making an additional, as everyone has already mentioned this morning, 786,000 doses available starting tomorrow, with continued distribution over the course of the coming weeks. I'd like to share a bit about the distribution of these vaccine doses. First, building from the CDC allocation formula, which Jenny just referenced, HHS was communicating the next round of allocations to jurisdictions today. We will also make this allocation formula publicly available on aspr.hhs.gov today, soon after this telebrief. Tomorrow, we will open ordering on our current system, so jurisdictions that would like additional vaccines immediately and can receive them over the weekend can order them. And then starting Monday, jurisdictions can begin placing orders through a centralized ordering system. This is the same system jurisdictions use to order COVID treatments. But again, if jurisdictions are ready to place orders before Monday, we're happy to take those through our current email system. Finally, and this is an important part of what we have learned from the COVID response, as the jurisdictions continue to ramp up their vaccination efforts, HHS will continue to calibrate the vaccine allocation strategy based on data we receive from jurisdictions regarding usage and administration. This will allow us to continue to distribute the vaccines to all jurisdictions across the country, while also ensuring we retain a little bit of flexibility to direct any additional doses to those states in most need. Our goal is to ensure flexibility on the ground by continuously assessing the outbreak, reviewing our inventory, and understanding how the vaccines we've already distributed are being administered. And this is all something we currently do in our COVID response. While this is a tremendous boost to vaccine availability, we know that more needs to be done. Since the start of the outbreak, HHS has purchased an additional 5.5 million doses of Jynneos vaccine on top of the over 1 million we already owned. And we are currently continuing to work with our supplier to identify opportunities to further expand supply and accelerate availability of this critical vaccine. When including doses already distributed, the federal government will have secured more than 6.9 million monkeypox vaccine doses by mid-2023. Again, thank you for the opportunity to allow me to share some of the work we are doing to respond to this current monkeypox outbreak. And now I'll turn it back to you, Sarah.
Thank you so much. At this time, we will invite questions from reporters on the line. And so as a reminder to anybody who has a question, please do hit *1 to be added to the queue, and we will turn to you very shortly. Our first question is going to go to Cheryl Stolberg with the New York Times. Cheryl? Operator, can you please help us patch in Cheryl? She had a question at the top of the queue. Okay, we're going to turn to someone else in case we're having some audio challenges. Our next question comes from Spencer Kimball at CNBC.
Hi, can you hear me?
Yes, we can hear you.
Okay, great. So how many people in the U.S. have estimate of how many people would, need to be fully vaccinated to help contain the outbreak? And just one final question. House Democrats this week requested additional funding to support sexual health clinics in the current outbreak. I'm just wondering if HHS is doing anything to support them financially, and would declaring a public health emergency potentially free up funding for them? Thank you.
And Spencer, I need to ask you to repeat your first question because you cut off midstream.
Sure. So my first question was about the vaccines. How many people in the U.S. have received at least one dose of Jynneos? And does HHS have any estimate on how many people would need to be fully vaccinated to help contain the outbreak? Thank you.
So I'll let Captain McQuiston give you a more detailed response, but the numbers that we have to date are in the low thousands. We know that there are probably going to be many more cases than that, but let me ask Captain McQuiston to provide the response.
Thank you, Secretary. So right now, I don't have a number to give you on how many people have received vaccine. We know how much vaccine has been distributed to states, and they're currently in the process of vaccinating people through clinics and various means. And Dawn might have more details on exactly how much vaccine has been shared out to state health departments.
Thank you. At this point, 338,000 doses have been made available to the states and jurisdictions. And we're in the process of signing data use agreements to be able to get the administration data back in to our accounts. So currently we know 338,000 have been distributed.
Thank you. The next question, we're going to try to go back to Cheryl Stolberg at the New York Times. Cheryl?
Cheryl, if you're there, we can't hear you.
Hello?
Is it Cheryl? Oh.
Hello? Can anyone hear me? I'm on this call.
Cheryl, your line is open.
Now we
Hello?
can hear you.
Can you hear me now?
I can hear you now.
Excellent. I'm not sure what was going on there, but I've been listening. This is for you, Mr. Secretary. I have two questions. First, as you know, Senate Democrats just dropped $21 billion for emergency COVID funding, and I'm wondering if you're expecting that some of that will go towards monkeypox. And then second, it appears clear that you're weighing a public health emergency, and you've got a lot of requests for public health emergencies for gun violence and reproductive rights, et cetera. I'm wondering if you can just talk about the considerations and how you're weighing, you're thinking on whether or not monkeypox should be a public health emergency.
Sure. The first question, Cheryl, we have communicated to Congress what we believe would be a good path forward on monkeypox, what it would take in terms of resources and authorities to be able to move forward and, as I've said, stay ahead of monkeypox and to end this outbreak. We have shared with Congress as well what it takes to continue the fight on COVID. We hope that Congress will act on both. And so we'll see. We will continue to provide whatever information and technical assistance they request of us so they can try to pull together a plan both for COVID and for monkeypox. In terms of the public health emergency and how it weighs relative to other issues, we're going to take each one as they come before us and engage based on the criteria for calling a public health emergency. In this particular case of monkeypox, what I can tell you is we continue to monitor the response throughout the country on monkeypox. As I've said, we've made vaccines, tests, and treatments well beyond the numbers that are currently needed, available to all jurisdictions who manage their public health systems and are the ones that work with clinicians to make all three, the tests, the treatments, and the vaccines available. And we will weigh any decision on declaring a public health emergency based on the response we're seeing throughout the country. And bottom line is we need to stay ahead of this and be able to end this outbreak. Thank you.
Thank you. Our next question comes from Madison Muller at Bloomberg News. Madison, over to you.
An operating division and sort of how the Becerra sees ASPR now fitting into the broader HHS ecosystem when it comes to pandemic response and in this response, and will ASPR be taking on a more important role in responding to health emergencies now going forward?
Okay, Madison, we missed the first part, but I think it's about ASPR and what its role will be moving forward. If things changed, if that's not right, you can correct me or ask a follow-up question. But in terms of ASPR, what we've seen is that it is critical to have an operation at our disposal that lets us respond quickly, aggressively, with volume to try to make sure we address an emergent public health condition. And ASPR has proven its value throughout COVID and before as well. But certainly with COVID, we've learned a lot. And I thought working with Assistant Secretary Dawn O'Connell when she was the Assistant Secretary for ASPR, that it seemed a very logical next step to provide ASPR with additional authorities and for the greater ability to move quickly and still be able to advise and counsel here at HHS, those of us who have to stay on top of this as well. And so hopefully this makes ASPR more agile, more prepared, and with greater tools to respond as emergencies and public health threats emerge. I hope I've answered the question.
Yeah.
Thank you, Secretary. Our next question goes to Matt Perrone at the Associated Press.
It's my understanding that in addition to these 1.1 million doses we're talking about today, the U.S. owns or has the option to buy many million bulk materials that could be made into many million more doses. Is that what's reflected in the 5.5 million doses for next year, or is there additional material owned by the U.S. beyond that?
Great question, Matt. And we absolutely do have access to more doses of vaccines. And again, this is a testament to the work that Administrator O'Connell and the team at ASPR has done. Let me have her give you the specifics because we know a lot of different numbers are floating out there, and we do want people to have accurate information. But yes, we will have several million vaccines available as we go into 2023. But Dawn, want to give a more precise answer?
Absolutely. Thank you, Secretary. That was a really good start. So just a few particulars about what the Secretary just weighed in on. We, in addition to the 1.2 fill-finish vaccines, which we now have fully in the U.S., thanks to the FDA work this week, we also had 16.1 million doses in bulk drug substance that our manufacturer was holding in storage for us. We intended that to be used for a lyophilization program for our smallpox preparedness, but we immediately began putting all of those doses that we thought were necessary that we could afford to fill finish into our monkeypox response. So right now, of that bulk drug substance, we have ordered 5.5 million doses to be fill finished over the course of the next several months. That equals that 6.9 million total that I mentioned. But that also leaves 11.1 million doses that we also could fill finish pending additional funding from Congress. So I think this goes into what was mentioned previously about the need for supplemental funds. We've gotten an additional 11.1 million doses pending supplemental funding that we could access and put towards the monkeypox response.
Thank you. Those are definitely important points. And at this time, we're going to turn to Dan Diamond at the Washington Post.
So much. I hope you can all hear me. I believe that the Secretary said this morning that the goal was to stay ahead of the outbreak. Is the goal to stay ahead of the virus or eliminate it? Can we still do that? And then a second question, I think for Administrator O'Connell, the outbreak has been concentrated in the MSM community. How will you manage vaccines if the outbreak spills into broader populations?
Dan, thanks for the question. If you heard me at the beginning, I said we want to stay ahead of the virus and end the outbreak. It's a combination. You can't just stay ahead and you'll be running forever. You want to end it. And so, but you can't end it if you're falling behind. So our task is to stay ahead of this. And that's why we have procured more than 1 million vaccines already, even though there have only been less than 5,000 cases. That's why we have made 60 to 80,000 tests available, testing sites for testing of up to 68,000 a week available, even though the number of tests being performed is only a fraction of that number. That's why we have 1.7 million treatments for those who have contracted monkeypox, even though we only have, as I said, less than 5,000 cases reported. So we want to continue to stay ahead of this. We don't control public health in the 50 states, in the territories, and in the tribal jurisdictions. We rely on our partnership to work with them. They need to work with us. And those numbers I gave you work to stay ahead so long as everyone is doing their part. That's why I said we've all got a responsibility here. All the communities that could be impacted, including those that are most at risk, have every reason to understand monkeypox and do everything they can to stay ahead of it. And so it's the prevention, it's the treatment, it's the education and the outreach. We're going to do everything we need to do. We believe that we've done what helps our state and local healthcare partners stay ahead of this, and we'll continue to monitor because we cannot let this get out of control, and we will do everything on our part to be a good partner to our state and local governments, who ultimately are the ones that determine how healthcare is administered in their jurisdictions.
And Dan, I'm happy to take your second question. That's a really good question, and it's certainly one that I spend a lot of time worrying about, which is my job. What could come next? Are we prepared for this to expand outside of the current community at risk? So that's one of the reasons why the 11.1 million doses I mentioned that are currently in bulk drug substance that we would like to go ahead and get fill finish is critical. because I don't think we can, we don't know what comes next, and we need to be prepared for the spread into the larger population and have additional doses that we can turn to. So that's the reason why we would like to go ahead and get that additional 11.1 fill finished, have it available. If it turns out this total of 17 million doses that we will have procured over the course of this outbreak so far is too many, we immediately put it towards our smallpox preparedness program, which we've currently emptied out some of in order to be able to respond to monkeypox. So we will use all the vaccine one way or the other, whether it's in smallpox preparedness or in the current monkeypox outbreak. And I tell you, if it turns out we need more than that, we will pivot immediately and begin to secure any additional doses that are needed for an even, if it gets beyond the 17 million that we currently have. Over.
And Dan, if I could just, again, put the exclamation point behind what both Dawn and I said, and that is that we'll need the resources to make that number of vaccines available to the American people should we need them. We're doing everything we can so far, but we need the tools to go bigger. And so that's where we need all our partners, whether it's, I said, state and local health officials, whether it's the communities most at risk, or whether it's Congress. Everybody's got to roll.
And at this time, I think we can take one more question on the topic at hand. So we're going to turn to Ariel Cohen from Roll Call.
Hi, thank you. I just sort of wanted to double down a bit on what Dan Diamond asked. At this point, is it possible to contain this virus? You talk a lot about ending it, but the way cases are spreading at this point, would you say that monkeypox is on track to becoming endemic in this country? And what do you all imagine the fall will look like when it comes to this virus?
Well, I'd almost turn that question back to you, Ariel, and ask how many vaccines do you think we need at this stage? Now, there are 330 million Americans. We could try to vaccinate all 330 million, but as we've seen with COVID, which is far deadlier, there's not a person who's died from monkeypox. We've lost over 1 million people from COVID. We still haven't seen every American get vaccinated with a vaccine that has proven itself to be effective in keeping people alive. So on monkeypox, if there are so far less than 5,000 cases reported, but we've already made available to jurisdictions throughout the country more than 330,000 vaccines, and today we're announcing that another 786,000 are available. How many more vaccines would you say we need today? If the response is we're not going to expect any type of prevention work by the communities at risk, by the state and local officials, then chances are we're going to have to go to the really high numbers of vaccines. But if everyone does their work, and remember, containing a virus requires a lot of preventative work. That's why we did masks. That's why we did social distancing with COVID. We know what we need to do pretty well on monkeypox. And so to the question, can we not only stay ahead of this virus, but end this outbreak? Absolutely. And we believe that we have done everything we can at the federal level to work with our state and local partners and communities affected to make sure we can stay ahead of this and end this outbreak. But everybody's got to take the oar and row. Everybody's got to do their part. We don't control, as you can see from our lack of data that we've gotten from jurisdictions on what they're doing with their vaccines. We don't have the authority to tell them what to do. We need them to work with us. And so I would say that if you're asking the students in the classroom who did their homework, I will raise my hand and say that at HHS we've done our homework.
Thanks, Secretary. And at this time, we are going to turn to a person who expressed another question earlier in the call that we said we'd get back to before closing. This is from Spencer at Bloomberg News. Spencer, if you're still there, we'll turn to you.
Hello?
Spencer, did you have a question?
Yeah, sorry. I wasn't sure if you heard me or not. So House Democrats had requested additional funding for sexual health clinics this week. We're on the front lines of the outbreak. I was just wondering if HHS has anything in the works for that. And a public health emergency was mentioned before. Would declaring a public health emergency free up funding to potentially help clinics? Thank you.
Thanks, Spencer. We've done a number of things both before and since the Dobbs decision to try to make sure that every American has access to the health care they need. And that certainly includes reproductive health, and that, of course, includes abortion services as well. We will continue to do that. We have been working with many of our community health centers to make sure that they offer services to every American, especially those who are less financially able to cover some of these costs. We have continued to work on family planning programs throughout the country. We've expanded the scope of family planning services and the resources made available to those agencies since the president took office. And we continue to work to make sure that in jurisdictions in the country where it now has become very difficult for women to exercise their reproductive rights, that we work with them to make sure that no one goes without the health care they need. And we will use our authorities at the federal level to protect those rights that women have, that providers have, to make sure that women are receiving every single type of healthcare service they need, up to and including abortion. Thanks, Spencer.
And at this time, we will conclude the call. As a reminder, for anyone else who has questions, our team would love to hear from you. You can reach us at media@hhs.gov. And we thank you and wish you all a good day. Take care.